have to know about discipline and dietary habits. There is no lack of knowledge what to eat, what not to eat. Suddenly they are not taking any food. Naturally, it happens because the hormonal balances will automatic alarm their metabolic disorders. So that's why they are highly impacted for cravings. I can say gut is connected with neurological disorders. So that's what gut will be called as a second brain. Gut microbiome is divided into two categories. One is harmful bacteria and good bacteria.
Welcome to Health Unplugged, our superstars, where we bring you medical expertise, practical insights, and real conversations that help you understand your health beyond the headlines. In today's modern age, we have convenience, speed, and even endless choices when it comes to food. But at the same time, we are seeing rising levels of immunity disorders, chronic fatigue, stress related issues, and even weakened immunity. What many people don't realize today is that nutrition is not just about diet or weight management. It is deeply connected to mental health, immune strength, metabolic balance, and how we even deal with stress levels. We are joined today by Dr. Dhanamjaya, a clinical nutritionist who extensively works on lifestyle related nutrition strategies that help the patient in terms of modern lifestyle related issues. Welcome to the podcast, sir. We are delighted to have you on a podcast.
Have a great day. You too. I'm very honored and privileged to connect with One Health Assist platform. So my name is Dhananjay. As Deena introduced, thank you for the kind words, Deena. You can ask wherever I can help you better. Yeah. So because this is the platform where we can help to bring a good modern lifestyle.
Let's get started and to understand how the modern lifestyle today is affecting the food that we eat. So, doctor, what I would like to know here is compared to the previous era where nutritional values of the food were retained or taken up by the consumers, today in a lifestyle which is fast paced and even work life balance is not in a good state, how is the nutritional value of food being impacted in terms of how the consumers are eating? Maybe
Okay.
more of a junk food, I would say.
Yeah. So nowadays it is very struggling. People what to do, what not to do.
Right.
Right. In that confusion state of mind,
Exactly.
whether it is good for nutritional or not. First of all, we have to know about discipline and dietary habits.
Okay.
Whatever we want to go first time to do, or doing anything first time, or already we have experienced it. Okay, so whether it is a food or professional life or whatever it is, what we need, as by my experience and my clinical knowledge, I am observed many cases. There is there is no lack of knowledge what to do, what to eat, what not to eat.
Right.
Because everyone aware of food nutritional benefit is there, everything is they know, or otherwise they can search in Google, is this food really helpful for me, my body? So all type of questions will come in the mind of the patient who
Right.
is struggling with some kind of diseases according their health lifestyles. So for that, what I suggested initially, first you have to know about how to develop and discipline a good habits, because it is the foundational and basic. If you start anything, if you go for tomorrow starting with a good professional starting with a good professional career, what there you have to understand about yourself. You have to build your character. How we can build character? By develop a good habits. What are the good habits? Good habits means already. Good exercise. What are the good habits? Taking good nutritional food, enough sleep pattern, adequate rest is there, he is asking na. So because nowadays people has sedentary hectic lifestyle, they are not able to manage their food eating habits time
Yeah,
to time
we will
because
skip the
uh,
meals.
yes, sometimes as you said, skip the meals, or it depends upon the time factor maybe, or they may be myth of they are gaining weight,
Right.
so that's what I want to cut down my taking food. So that
Intake
is
of the
also
food.
one of the drawback. If that comes in their mind, what happens? So suddenly they are not taking any food, and what attracts their cravings increases.
Right.
That's why they are attracted for craving food. So all of a sudden what happens? They completely fasting on diet.
Hmm.
So naturally it happens because the hormonal balances will automatic alarm their metabolic disorders. So that's why they are highly impacted for cravings, and they go for craving eating food, processed food. So that's why they are the causes most of the cases we are seeing nowadays. So them spoiling themselves
Right.
knowingly,
Hmm.
right? So
So,
that's what.
so to sum up what doctor just mentioned, in today's internet era, a lot of information is available on the internet about food, nutritional values, your diet. But what is lacking is the discipline in terms of daily routine, and that's the important part that we are all missing out, and it's an alarming one. So, based on the discussion we just had, doctor,
Hmm.
my next question would be, what are the challenges or the issues people are facing related to nutritional facts of the food?
So once hunger has satisfied, you don't go for food. So then there is no choice of taking and time also. He asked, na? So what to eat, what not to eat, right? So then you just completely avoid your good food, which is helpful for your lifestyle.
Correct.
Okay. So then there is a scarcity, and there is sometimes knowingly, unknowingly also we are doing mistake ourselves.
Mm-hmm.
So that means we are spoiling our health, we are giving our health, our own we are spoiling. Everyone is not has not a right to take fiber intake or protein intake. Nowadays what is happening in commercial ads also, I am not putting down anyone, commercial ads or any
Okay.
people. So they are doing as per ads or commercially, it is okay.
Hmm.
But if you go, if you attract for the ads and everything, it is not good taking advice, because they can say, if they come up with a good product, protein powder as you said, and they can add also, they can mix with fiber also.
Absolutely.
It is especially designed for diabetics
Hmm.
or cholesterol more food taking. Their increase, they depends upon their weight, different aspects of the health challenges of vary of to every individual, right? So coming to your point, what I want to suggest, you can understand whether the fiber is good to for your health or not, the protein is good for your health or not, and it is also how much protein you have to take according your weight and desire and requirement, and based on your sedentary lifestyle. That is also a key factor of taking protein, whether it is a fiber or protein. So you have to concern, if you know it, okay, it is good. For that you have to take a consultation opinions as a advised doctors if you don't know, right? So that is the we I can advise.
So next time when you want to select or when you want to come up with your diet plan or when you want to know which nutritional value is sufficient for you or appropriate for you, consult a dietitian on One Health Assist and even use the consultation in online and offline format and get your diet consultation done in an appropriate manner. So next time when you want to know about what you are eating throughout your entire day, use the calorie tracker one click feature, which is available on One Health Assist website, and it's also available for patient interface. Use this feature to understand what nutrition and value you are eating throughout the day. So nowadays, doctor, people think that nutrition or the diet plan is purely for the purpose of weight loss, not to handle any physical or
Other health
bodily
challenges.
disorders. Is that really true?
I think I can say it is a myth of
Okay.
their mind, because they, as you said, as you asked the question, I appreciate you, the good question you are raising me. So people are mostly, they what they thought, once they increased their weight beyond their limitations, so then they strike their mind strike.
Yeah.
It is a alarm to meet
Meet.
consult a physician, right? It is not like that. uh, of course it is good one, at least they have one kind of decision to take,
Right.
at least. Okay, we can appreciate for that one. But coming to other point, it is only not only for weight management, each and every aspect of even normal people also, everyone nowadays looks for consultant, good nutritionalist or dietitian, who want to take a good nutritional part, or whether it is a dietitian part, according their health issues. So taking a decision accordingly, moving their suggestions and advices, they can take a good approach.
So
That is
basically, the diet plan not just helps to manage the weight, but there are some physiological or disorder related issues that can be tackled through nutritional.
only people who are not struggling people. Nowadays everyone wants to get a good advices from the consultant physician. So it's not only for specifically, but also everyone needs.
Right. When nutrition based diet plans are given and the body starts improving, so what are the signs that are given by the body and how it impacts that individual?
So there is no specific positive sign, I can't say. Okay, so but you can understand by taking good, as I said, once you develop your habits, what happens, automatically your gut knows.
Right.
So he is giving me good nutritional benefit, which is I can help him better than previous what he takes. So once your gut knows whether you are giving to gut good nutritional benefit or harmful benefit,
Okay.
so then sign will be different. It can be, if I can say, it is irrespective of his physiological orders will be placed in.
Okay.
I can't say particularly only this is the good sign for you. So I can't say, whatever the sign, positive sign you expect, that I can tell. Your gut tell, not I.
Okay.
Okay, you gut tell, that you can, whether it is a neurological sign, or your activity, or your accuracy of working.
So basically, it
uh,
impacts the gut health,
uh,
and then gut health decides which
which is
body part or
uh,
which system is going to
which
have best
hormonal
impact.
he is
Yeah.
giving a good
Response.
nutritional benefit, that obviously you can know.
So since we were discussing about the gut health, there are a lot of discussion that happen which says that gut is the second brain. So scientifically, how that can be explained to our viewers?
uh, as I can also agree with the scientific approach.
Okay.
So
It being
nowadays,
called
what
as the
is happening
second.
previously, we can, as earlierly he asked, na, so earlier people are good. They are good habits with nutritional
Right.
taking, good food habits, good dietary habits, good discipline, everything, and they need not to go for working somewhere. They are housewife, or
Right.
most of the agricultural
Mm-hmm.
also. People, the right from the beginning era, they are started with agriculture.
Yeah.
Our first, if I can say, first is hunting
Hmm.
before killing. So
Yeah.
then let us start with agriculture,
Hmm.
right? Then industrial age starts.
Right.
So no worry of about financial struggles or these things.
No
Peace
stress
of
at
mind
all.
already is there. Their own farming is there. They
Yeah.
can farming their own, harvesting and everything. Huh? So coming to your question, so
Why
it
is
is
the
a
gut? Yeah.
scientific. There is a scientific reason, as I said. Whatever in food, or whether it is not only food, but also we can take it is a liquid basis also, whether it is a water content or liquid content, whatever it is, only not a solid here. Okay, so once your gut feels, it is as a health, good nutritional value. It understand, once your gut understand, gut knows, that is the good sign also. So and the accordingly the nutritional benefit is also there. I can say gut is connected with neurological disorders.
Right.
If our gut is not in proper way, the signaling,
Neurological signals.
neurological signals is also imbalanced.
Right.
So that's what gut will be called as a
Second
second
brain.
brain.
So, doctor, what are the factors that affect the gut health?
So almost our neurons will be connected with the gut.
Okay.
Okay, so then what happens, if you have not given a good digestion, good nutritional, good nutritional value, so or it is sometimes the nutritional may be overloaded.
Okay.
It causes toxic.
Right.
Okay, so that also impacts neuro disorders. If I can say neuro disorders, it is metabolic disorders happens according our brain. I'm not too much connected about talking for the neurological science, but the impact will be highly is there, because the your sleeping pattern might be causes, your thinking pattern causes, your way of taking stress
Hmm.
is also one of the load of highly impacting your neuro disorders.
Correct.
So these are all, whether it is a metabolic disorders or neurological signs, whatever it is. And it sometimes if you keep on prolonging it, so it might be causes of up and down orthopedical reasons also will
Also.
be happens.
So,
So
as you just heard, gut health is related to a lot of systems in the body. Neurologically, it will affect the mental health, stress levels, and how you work throughout the day. But it also affects on the metabolic disorders also. Since we are talking about how the body reacts when a gut health is not maintained, many people experience a lot of bloating, acidity, digestive disorders. So, are these all affected just because the gut health is not maintained in a good way?
yeah, absolutely.
Okay.
So if digestion will be, there will be a indigestion causes.
Right.
What happens? For that, I can give you a good example. In our house, you can take an example.
Hmm.
There is a separate dustbin.
Right.
So what happens if you keep away your dust on a daily basis? What happens?
It accumulates.
Accumulates, spoil
So, yeah.
entire. So the same thing here happens. So then your gut, you are giving chance of to your gut. So I am filled with all these
Impurities, we should say. Okay.
okay, so then the symptoms shows, causes constipation, indigestion,
Bloating.
bloating, acidity, or I can say here you can emotional changes.
Yeah,
So
imbalances
huh,
basically.
and causes also, if you keep on prolonging, what happens? Obviously we can impact it. So likewise here also, you have to detox your gut
Okay,
to keep it in proper with
balance.
good nutritional, or give, sometimes it is also need detox, or also you can give some time to space to digest the food whatever you have to take in the morning breakfast, evening breakfast. So you have to give some time to
Right.
digest, and give a good benefit to it.
Let's move to the next question. What role does the gut microbiome or a good bacteria play in terms of digestion?
Gut microbiome is divided into two categories. One is harmful bacteria and good bacteria. Okay, so it is based on selecting our based on our digestional, our good
Food.
dietish, good nutritional habit,
Okay.
taking in our diet, daily regular diet. So gut microbiome is connected with some pathogens.
Right.
There is a good bacteria, harmful bacteria, and helpful bacteria will be categorized. And the microbiome is categorized. For that, we have a good test also is there. So nowadays, it is also good one to go with that test. Gut microbiome test, I can say. So once you there, you can understand and differentiated. You can find the report, clinical evidence. Just giving a only sign is okay, good, but how much it is, we can't judge, right? So with a clinical proof of evidence, you can differentiate gut microbiome is harmful bacteria is how much percentage it is, and healthy bacteria how much percentage it is. So once we can understand, according the diet and nutritional
Plan is divided.
plan will be categorized based on the individual
Right.
patient.
So we just heard how the normal flora of gut is different from a pathogenic flora of gut, and there are tests available that can differentiate between these two, and also suggested by a clinical nutritionist when it comes to improving your gut health. So that was really nice of you, sir, to explain this in so much of detail. Let's talk about something that is trending nowadays: immunity boosting foods. So actually, sir, we have heard on internet or the detail that is available right now about immunity boosting foods that are available or that are taken up by the consumers or the patient. But scientifically, so does it actually change your immunity overnight with the immunity boosting foods?
Overnight, I can't say,
Okay.
because just giving nowadays what is blindly, that's why government is also taking the precautionary steps,
Right, right.
so giving a prescription and accordingly give the medicine and everything. Pharma recently I
Yeah,
have seen
OTCs
in
are not
many of the
available now. Yeah,
states also. So it
absolutely.
is bring that, that's I can appreciate for that one. So just like food is also a kind of chemical substances will be happens,
Yeah,
whether it is a nutritional or dietitial aspect or whatever it is. So not only taking a medicine, whatever you have to take in your diet, it as scientifically we can, I can say. So it is a chemical substance. So once it is not a good formula, good based on the taking food. So what happens? Automatically it impacts health. It may be causes, as he asked, our immunity. Okay, so coming to his point, overnight it not happens,
so does
because
it
there
give,
will be a
yeah,
connection of his or her health.
right.
So everything is a connectivity here. If there is no multiple connections for everything, whether it is, of course it is a small thing, you can, because nowadays people are why can't we try with it? Of course it is not a major kind of, but it is a symptom where it happens, the organ stage it is, or the tissue stage, we can, I can say that one. Once you reach it as we can understand. So the stage of the condition where he is struck, his immunity level is fallen down.
Okay.
Accordingly, we can guide. So that does not mean overnight taking a tablet
Yeah.
overnight, but some, whether I can't say is that really helpful for his
Body or
immunity boosting aspect.
so there are a chain of reactions that occur in a
Ha,
body
based on
that
his
decides. Yeah.
his or her health conditions. No?
Okay.
So that just to be aware of whether it will be good for his health or her health.
Right.
Then accordingly you can take. But overnight expectation is not, that's not true.
Okay.
I can say.
Okay. So, sir, since we are talking about immunity boosting here, is immunity more about long-term benefits or it's about a short-term solution to a patient's body?
So whatever the good habits I can say, where you can ask me, you can surprise why he is asking good habits, good disciplinary habits, right? So if anything, if you go your office, example, okay, are you daily doing your work, routine work, whatever it is, as designed for you? Okay, so is it daily you have to go and visit, do your routine scheduled work, or this month I can come tomorrow, after 1 month I don't come, then next month I will come, I will do work. What happens? You can tell this.
It's a disturbed pattern. So basically, it's what you're trying to say is it's a long-term plan where disciplined work is needed in terms
Connectivity
of
is there.
dietary plans.
Yeah, likewise here also. Once you have to stick on your whatever your goal, it is connected with. Suppose you have overweight, or you are a health challenges of a neurological disorder or metabolical hormonal disorders.
Okay.
Okay, there is a certain period of time is there, schedule is there. Accordingly, you have to follow that. If you follow, you keep on, you keep want to giving a space and time, taking rest, after that again I have to start new plan, then what happens? Your gut is also, or your
breaks,
your total plan will be, it is confused, so there is no clarity for it.
Okay.
Even if you know clarity, how can you follow?
Right.
The same thing is here.
Sir, are there any particular nutrients that play a major role in boosting our immune system?
Yeah, obviously.
Okay.
So, based on the, we can also say immunity. If I can say immunity, it is what kind of issue he is struggling with immunity. So, it is designed maybe irrespective of factors as per his. So, first we have to clinical proof.
Okay.
So then accordingly we can suggest them, as he has to take protein, or he has to take antioxidant, or he has to take antibiotics.
Okay.
Or if all these not supported, he has to go and visit, get a clinical advices, or treatment also sometimes. So all comes in factors.
Okay.
So I can't say, oh, okay, but as you asked me, good immunity boosting, I can say protein is the good one.
Okay.
And that is also connected with amino acids.
Okay.
Nowadays we are scary of amino acids. Some amino acids, but we can see whether we have to use the protein. There will be is it plant based protein, it will be, otherwise if it is, what happens, the immunity again struggling,
Right.
giving a good nutritional or not.
Correct.
Right. So that's what.
Okay.
So even if I can say antioxidant, whether the patient is allowed according his health, he has to take the antioxidants, how much content he has to take, how much value of the nutritional in a day he has to take, how many times he has to eat, whether the food is only enough or he has to add supplement portion also.
Okay.
So based on the irrespective of the this one
So when you want
factors.
to know about what works best for you as a matter of fact for nutrients that are best for your gut health, you can consult a dietitian, a nutritionist on our One Health Assist website and get a customized diet plan which will work best for you. So when we are talking about diet plans, nowadays people take a lot of supplements. So the whole food that we used to eat earlier, can it be better in terms of managing the immunity compared to the supplements?
Yeah. Nowadays, what is happening? Everything, everyone can say we are organic.
Okay.
Okay.
Yeah, absolutely.
So, right.
Kind of, yeah.
But we don't know. Label can see. We can see
Hmm.
whether it is a organ based. But is that really it is coming from organic based or not? We have to see the history of even physicians never go and visit where he is for developing the forms and bringing the whether it is having organical based or not, right? So there is no time at all for no one, even physician also, right? Just they can say this is the good one.
Let's talk about the imbalances that we have in our today's life and how does that weaken the immune system or how does that affect the immune system. So today in busy world we have sleep, incomplete sleeps, or unbalanced diet plans or skipping meals. So how does that impact on weakening the immune system and what should one take care of?
Obviously, nowadays it is a hectic lifestyle, as we earlierly discussed about this one, sedentary lifestyle,
Right.
and also there is no peace of mind because what happens? Peace of mind, I can say, it may be a financial challenges or family struggles, or sometimes it is overload of working, right?
Right.
So and also there is no specific timings. Nowadays what happens, someone will work with a schedule, morning schedules, day schedules, I can say.
Right.
Someone work with night
Night
shifts
shift. Right.
because everything is a software related or
Hmm.
is AI related or whatever it is. I don't know specifically that particular terms,
Yeah.
but I can say, as I my knowledge, I can say. So obviously it impacts because according we can say it is a environmental disorder. For every there will be a geographical connectivity is also with science
Okay.
wherever you are living. So the geographical aspect is also plays a major role. What kind of foods is? Otherwise, if you go for south region, there will be a specific food. If you go for north region, you go for specific food, and the which are mostly available, which are so scary, only seasonally available, right? So likewise here also what happens, our health mostly impacts.
So poor sleep also impacts the immune system.
Obviously, because the sleep circadian rhythms pattern impacts highly,
Okay.
because as per schedules, of course you can think as previously you are going you are living in normal, everyone whatever they lives in, everyone is okay, good one. Once you select, you got a interview, got corporate, you tomorrow onwards you want to go for corporate job, right? So corporate sector, so there will be a for you night shift slots.
Okay.
Okay, so
Basically, you're
you are a
talking about
fresher,
stress. Yeah.
you are a fresher, you start with fresh, or otherwise you sometimes, irrespective of their seniority or fresher or whatever it is. So according the company rules and regulations, or you have to do, right? Whether it is a night shift. So then what happens? The circadian rhythm is normally as per your the region. It is previously it is okay. Now what happens?
This is disturbed.
Suddenly it is impacted. So it takes time. All of it overnight it can't, na?
Right.
So
It
today
just
you have to take in breakfast morning, and what happens in our streets daily, at 12 o'clock I have seen, I think last week or last month I went for night some function or like conference. So in return I see, I am surprised. Even 1:30, 2 o'clock, full crowded.
right.
Of course, it is Ramjan days, so everyone is busy. Still, their circadian rhythms automatically, because the time is to get sleep. But what happens if they are moving on streets and purchasing clothes and everything?
Okay.
So obviously it impacts circadian rhythms, and the pattern also changes. It highly impacts the once circadian rhythms imbalances will be arises, then thyroid will be is a symptom of hormonal imbalances, metabolic disorders, as we can say, or indigestion. Because at 2 o'clock you can take halim.
Okay.
So it is a complete protein food, na?
Right.
So
it takes time to break down and
break
get
down.
digested. Yeah.
Of course, you went through a fasting day, entire day, but the time is not suitable to take protein. It causes indigestion, imbalances. So obviously, once it happens, because the time is not suitable for your digestional tract, there will be a specific calendar schedule for your liver,
Okay.
gut. So this time liver functioning, this time hormonal imbalances, this time adequate rest, this time temperature goes hormonal. So all this comes in one factor, na? So that is a circadian rhythm.
So basically, poor sleep pattern, irregular eating habits, or even stress can impact your overall health and your immune system to a great extent. So set your reminders, pill reminders, water intake, your calorie tracker on one health assist platform, and use this particular feature to get tracked on a daily basis. Since we are talking about the rhythm and the body clock, how does stress impact on the overall health of an individual? Because nowadays everything is related to stress.
How we can overcome,
Yes.
right? So it is not, I can't say only completely based on the taking food and nutrition.
Okay.
Okay, everything not comes under only one category, talking about nutrition and dietitian, as you asked me, right? So stress, initially I told you, na? So adequate rest, physical exercise, taking supplement food, and positive mental attitude, these are the four pillars. Okay, so we can almost, we have so much discussion about nutrition and dietitian. So coming to adequate rest, so is it are you sure about you have to get rid from your office work at least 1 month or 2 months?
No, sir.
So how can we substitute that one? We can't replace.
You need to handle that particular stress in a different way.
Yeah, he asked me supplements, right? So there will be a specific supplements will be out there.
Okay.
Because of already the supplement is also helpful for the wherever the nutritional gap is happened, so it impacts health causes. Okay,
Correct.
circadian rhythm. So to fill that one, to fill that gap, we can add the supplements.
Correct.
So then you have a type, but that does not mean only supplement, taking supplement, I need not to go take a adequate rest.
Okay.
because that is your part.
We need to even
At
work
least
on the
you
reducing
have
the
to
stress.
plan your schedule, at least taking 8 to 9 hours minimum
Of sleep.
adequate rest.
Okay.
Once you are aware of that, taking food, feeding you food daily, and you have to give a time for taking rest,
Okay.
enough rest, that will also gives you relax of your hormones, cortisol or otherwise our dopamine impacts,
Right.
healthy hormones. So all these hormones are almost, I can say, three or four hormones,
Right.
fight hormones or will be there.
Hmm.
So all these obviously impact. So
Okay.
that's why we can't just put away your sleeping pattern, taking rest. So
Okay.
that's why doctors are also advising, na,
Right.
taking enough rest.
Rest. Right. So nutrition advice today is become more of a social media types or a nutrition or a influencer who is saying that what is good for your body. How does this quick fix diet impact, and how confusing this has become in today's landscape where a diet consultation is necessary?
If it is small portion of, okay. If it is connectivity, the question your question is, it is any thing you which you are not able to manage your health point of view, because nowadays everyone, as you said, the social media impacts is there, free advices is
Yeah,
there. Even a
influencers.
small kid, 6 years kid also can advise
Right.
what to take, what not to
Hmm.
take, because it is good for daddy you can take, or it is good for daddy you avoid this one, right? It is not, because you are educated person, you know everything. So and how you can go blindly asking Google, searching for video or any whatever. Of course I am not putting the advertisements, whatever you are taking, bringing up only, this is the, you can take it as a, okay, there is a consultant physician is there, we have to approach him according his health and his conditions, he has to take advice physicians,
Okay.
right? So that you know already, but as it is a information, not you have to implement that
Okay.
as you in your daily routine diet plan or nutritional plan, right? Okay, where it is there, nowadays people, how many reviews he
Right.
is having. So it is not like that, no. So you can understand, so whatever the bio is there, everything nowadays, different social doctors
Influencers. Yeah.
platforms like OHA. So you can decide wherever you have to just think about it. So it is good going before taking anything
Information to
without there is
yourself.
no proper information, it will help his or her health.
Okay.
So then you can take accordingly advice.
So, sir, is the concept of perfect diet realistic, or there can be alterations, or some midway solution which can an individual take so that the dietary requirements are met?
So I can say, I can tell there is a perfect diet,
Okay.
okay. So but it depends upon the patient, individual, how many, how much time, whether it is a perfect diet or not, I can't tell.
It's more about
Once you
consistency.
take whatever the concerned physician has advised you according the diet or nutritional plan for you according your health conditions, so it is okay. But it is not, I can't say it is a perfect, because even he does not know, na? Once you have to take your food, but he knows what is helpful for your diet, but once you have intake, you can understand.
Is the concept of perfect diet realistic in terms of consistency and balance? Say, for example, a dietitian has given a plan of eating X number of protein value, And if that is missed or there is a upper or lower limit used by the patient, does that affect or that's okay in a daily routine?
Okay. So whatever the suggestions and advices given by your physician, once you reach with your physician, taking the perfect plan, whatever it is.
Right.
Okay. So first of all, give me an idea why you want to think like that. Why I want to don't want to follow whatever he suggested. What insist in your mind?
There could be many reasons, sir.
May
If we
what are the
cannot
reasons?
follow the same amount or same number of
One day, okay.
nutrients, yeah.
So how many days you skip, or what is the reason of meeting, taking advice? It is meaningless,
Okay, so
right? Once,
inconsistencies matter.
inconsistency is not always, is not one day is okay. We can't. Okay, suppose today I will be meeting with a function.
Okay,
There also, you if you have a good good about your lifestyle pattern, eating pattern, there will be a food will be there obviously, but if it impacts your schedule, whatever the suggestions and advices given by physician, how you should blindly put it away? That means you are inconsistent about your habits.
so maintaining a balance is pretty important.
You have no confidence on about you.
Right.
So that blaming to doctor and your diet also. That is the symptom. Of course, one day is okay, but regular pattern, it's not okay.
Okay. What inspired you to become a clinical nutritionist, sir?
Actually, it happens in middle of my age.
Okay.
So after everyone has went through some challenges, right? Quite natural, right? So in my house, I also face the issue,
Okay.
health challenges, especially if I can say health perspective.
Okay.
My mother was impacted with cancer.
Okay.
So okay, we will go. I approached with the physicians and taking opinions accordingly. I can give her good diet and diet plan or whatever their suggestions. I follow blindly.
Okay.
So, but what happens sometimes? It is not only taking just physicians, okay. So because why I am telling you, so at that time there is no of course, if it is there or not, I am not sure about that. Nutritional dietitian nowadays, it is
Available easily.
well available, every corner, nutritional and dietitianal taking advices, consultant physicians, even doctors also go and meet recommending the dietary habits, taking good advice from a dietitian nutrition, right? So in those days I have not found anyone like
Okay.
that one. So that is the one of the thing, because cancer you can know, so how it impacts overall health.
Right.
And my mother is also affected. It is a conditional change of third stage
Okay.
almost. There is a as per the doctor's advices, she has to follow radiation as well as chemotherapy. So you know well how chemotherapy impacts the cells and result. Even cell can dead, right? So these are all.
The factors.
Of course, I have some supplementary knowledge is also there, nutritional. So during those days,
Okay.
so that also realization came. So what I have to give my mother, what is the good supplement also adding in her diet daily. So there I can understand. Then once she get after using the supplement and everything, she is okay now, she is well.
That's
So
nice.
then I came into a realization, I should help and serve. people who are really struggling what to do, what good food or nutritionally is that helpful,
Okay.
as well as nutritional and food taking. Also supplement is also, because sedentary lifestyle is one of the reason. So to complete avoid the diet sometimes, or
Okay.
irrespective of circadian rhythm,
Right.
right? So that gap will be filled through supplement.
Okay.
So wherever the deficiency happens, so this gap supplement will be reaching. So then patient will be normalized. So all this comes in. So that is
These
the
are the
turn.
factors that
Huh.
inspired you to
Mm.
become a
Due to
nutritionist.
this, I have a leadership aspect too, is also helping and empowering people
Okay.
in two aspects. So because sedentary, we can't avoid our professional, whatever we are doing,
Right.
professional career, right? So for that also, I can give a good advices for leadership perspective
Right.
also, because that will be considered as a how to develop discipline habits.
Correct.
That is also helpful for nutritional, who I am helping people.
Okay. This brings us to the end of the podcast where we heard about how stress, irregular eating habits, or even food intake can impact our overall health and immune system. Thank you, Dr. Dhananjaya, for bringing us so much of valuable information on this platform, and we are very delighted to have you on our podcast. It was great talking to you, sir.
It was nice talking with you, taking the podcast journey. One of my best advice: go through, follow the OHA assist platform. So which is good. There are number of specialization,
Right,
specifically I can say. So doctors are most specialization doctors are available in our OHA platform.
right,
So definitely you can use the platform. So it is a good way of taking your health advices and everything. So wherever you are there, you can reach the concerned doctor, physician,
right.
through OHA platform. Thankful to OHA platform for the best services giving the doctors especially.
Thank you so much, sir. So, next time, don't rely on the internet information. Consult a dietitian or a nutritionist on One Health Assist platform. I am your host, Deena, signing off for now. Please like, share, and subscribe, and stay tuned.